Another utilization of this cordless and wireless transducer, and then we want to show you how we can use the penetration and field of view of this curved linear probe. And we put the transducer right over the humerus, then we see the hyaline cartilage. Then we do a long axis linear slide towards the scapula. Then we ask the patient to do an external rotation of the humerus and internal rotation. When the patient externally rotates the humerus, you can see the insertion of the inner spinatus has pulled the humeral head to impinge onto the posterior labrum right here, and which is a sign of posterior impingement. She doesn't have very bad, very severe posterior impingement. But if this is becoming more severe, sooner or later, this patient will have posterior labral tear and maybe developing to a labral cyst. So this is a posterior impingement. So when we have this posterior glenohumeral joint in view, I pivot the medial end of this transducer cranially. Then you can see there is a pulsation inside the infraspinal glenn notch, the suprascapular artery going together with the suprascapular nerve and vein. So you can see this suprascapular artery and vein in the infraspinal glenn notch. When the patient is doing an external rotation, you can see the engorgement of the venous plexus inside the infraspinal glenn notch. If the patient is having a posterior labral cyst, and the cyst will push against the suprascapular nerve inside the infraspinal glenn notch, and you can see the fascicular pattern of this suprascapular nerve inside the notch. And right here, you can see the nerves. If we want to do an intervention, we can have the needle coming from lateral to medial. We can have the needle coming from here, and we can hydrodissect or block the suprascapular nerve inside the infraspinal glenn notch. Then we go to the joint. Then we, at the same needle hole, we can do intra-articular injection for the posterior glenohumeral joint. And after injecting solution into the joint and with the blocking of the suprascapular nerve, we can do a mobilization of shoulder under anesthesia. So this is the intervention of this posterior glenohumeral joint together with suprascapular nerve.